So when I first started practice, private practice about 12 years ago, I rarely did any spinal cord stimulators. And it's because, after, a year, 2 years, 3 years, a lot of patients were habituating. In other words, growing tolerant to it, and it just wasn't effective anymore. A lot of patients also, even if it did help, they were feeling a buzzing sensation down their legs and so forth, and it was kind of irritable. So it just wasn't that home run. And so I did occasionally, I occasionally did spinal cord stimulators, but now I do them all the time because the technology is completely different, and we'll talk about that here in just a bit. But as far as who do I think is appropriate for a spinal cord stimulator? The FDA, some of the FDA approved indications would be things like radiculopathy, post-laminectomy syndrome. So anyone who's had back or neck surgery before, this is something that might do well for them. CRPS, so complex regional pain syndrome, used to be called RSD, reflex sympathetic dystrophy. Also peripheral neuropathy, diabetic peripheral neuropathy specifically has the FDA approval, but anyone with any type of peripheral neuropathy can benefit from this type of procedure, since it really addresses the nerve pain, the neuropathic component especially. But those are some of the, there's other diagnoses, but those are the big ones that we think about.
I'd like to talk about a couple of those. So one of them where I can say that we had really great success with one of these, it was a patient that was older. He's since passed away, but at the time, it was his last few years of life. There was nothing we could offer him. He was severely osteoporotic, in a lot of pain and having horrible radiculopathy, but didn't qualify for any other procedures. Extremely, extremely high risk. I mean, just miserable. Really felt horrible for the guy. He would just rate it, off the charts, 9 out of 10 pain all the time, 100%. Can't get out of the chair, laying in the bed. Just miserable for months on end and just atrophying away because he couldn't do anything. And then spoke to his wife and then referred him over to Brad. And then when he got that, it was like all the pain was just gone and it stayed gone. And that was striking. So he was actually able to start at-home physical therapy for the first time.